welcome to the Pediatric Intensive Care Unit, or PICU, at UMass Memorial Children's Medical Center. I'm Dr. Scot Bateman, and I'm the Division Chief of Pediatric Critical Care here at UMass Memorial and Professor of Pediatrics at the University of Massachusetts Medical School. I'm speaking on behalf of our entire PICU staff. I'm sorry that your child is in need of intensive care services. We can only imagine how stressful it must be for your child and for your entire family to be here. We're very aware of that, but I want you to know you're in the right place. Our PICU is home of the finest experts in the area for critically ill children. We have the skill, pediatric expertise, and specialized equipment to meet all of your child's needs. Rest assured that whether your child is less than 1 or 21, he or she will have access to the best care available, and our team is going to do everything we can to make sure you and your child are comfortable and well cared for while you're here.
I think what made the biggest difference is the doctors treating us as people and speaking to us not in medical terms but as parents.
To prepare for your stay, I want to share a few things with you about your visit and our team of caregivers. Most importantly, know that we're here to help your child recover and to give you the support you need. Our compassionate team of nurses and staff will partner with you throughout your child's stay to ensure that all of you are well taken care of. Our experienced critical care attending physicians are leading and directing care 24 hours a day, 7 days a week for your son or daughter. All of our attending physicians are fellowship trained, which means they have an additional pediatric intensive care training, so we can offer your child the most specialized care possible. You will likely meet some of our outstanding pediatric resident doctors, all of whom have 2 to 3 years of experience caring for children as well. And our team also includes a number of pediatric support staff, including child life, respiratory therapy, pharmacists, nutritionists, social workers, case managers, and of course our outstanding pediatric nursing staff, all working together.
Our job as child life specialists is to help children and families cope with hospitalization and illness. For some families, that's supporting patients and their parents, helping them through tests and procedures. Sometimes that's with education and helping children understand what's happening while they're here in the hospital, including some doctor toys for kids too. We also are here to create a soothing environment for children. We have music boxes for the little ones, books for older kids who might want to read or be read to at nighttime. And we're also here to help siblings understand what's happening, because it can be a pretty confusing time for brothers and sisters as well. Please let me know if you have any questions. We're happy to help you.
We have dedicated pediatric subspecialists at the Children's Medical Center, including anesthesiologists, cardiologists, radiologists, neurologists, and surgeons, to name a few. We are particularly family-centered in our PICU. We strongly encourage your involvement in your child's stay. We know that you are the true expert of your child. You will be actively invited to participate in daily rounds with our team, where the care plan is discussed and questions can be addressed.
Rounds take place outside of your child's bed, and it involves the physicians and the nurses and the respiratory therapist. Everyone who's taking care of your child is involved, and it's very, very important because you are the most important person on rounds, that you are actively, you're able to participate and listen to the plan, and also we appreciate your feedback because you know your child best.
When we have rounds, we try to help prepare you and your child for what our goals are for that day and let you know what to expect and how you can be best involved in what goals we're trying to help your child achieve that day.
Please ask us for anything you need so you can be an active part of the care team, whether that is more information, coffee, or a quiet place to sit and sleep.
You're not alone. You know, there's other families here that unfortunately are going through, these tragedies, and just don't be afraid to ask questions, talk to one another, talk to the nurses, the doctors. No question's a stupid question. Just always ask what you're feeling.
The whiteboard gives you all the information you need to know who's taking care of your child. The nurse's name, the respiratory therapist's name, my phone number. Please call if you have any concerns at all. No concern is too small. All of the PICU staff members have a yellow badge. If you have somebody caring for your child and they have a white badge, please question them or let your nurse know that you're not sure who they are. Safety is of our utmost priority.
We welcome you here 24/7. We'll never ask you to leave. It's very important that you can be here with your child, but we do want to limit the amount of visitors here because the children need rest. Siblings can come when appropriate if they're not unwell, but we do ask that you always accompany the siblings with a parent, and we're not able to let siblings stay overnight. If your family members or if you are unable to be here with your child, we have a camera that we can put on your child and hook it up to the internet, and we'll give you a code and you're able to watch your child even if you're not here.
8 years later, we still talk to the doctors, the nurses that helped us out, because they really made us feel like family, and they really comforted us while we were here.
I don't wish nobody to be in a PICU with their children, but for some reason, this is the place to be. You can get the same level of care and professionalism what you can get from the Boston's top hospitals.
We are intensely focused and dedicated to the health and well-being of your child. Again, I'm sorry you are here, but trust that our team will help your son or daughter improve as soon as possible.